Today we are going to talk a little bit on a different topic, and this video has taken me multiple times to try and find the right words. I think I've recorded it 4 or 5 times for different platforms, and part of is because of the topic. So we are going to talk about abortion and women's health, and this isn't a pro or anti-abortion. And I hope by the end of the video that you're unsure of what my personal stance is on the topic, because at the end of the day, it's irrelevant. What is important is the way that women are treated within the medical health system and how our solution to things is apparently abortion. So I think this topic is really important for many reasons, and because it's part of it is it's not just us. So it's not just a female issue. It's not just a, well, it'll end once the pregnancy is terminated. That's just simply not the case. That's not true at all. So I've had multiple clients now come to me who have struggled with their health prior to pregnancy, but were wanting to become pregnant. So someone, for example, that was struggling with high histamines, somebody that was struggling, another client that was struggling with their thyroid, different things like that. Nothing that is saying, hey, you can't carry a pregnancy to term. And in fact, their body wouldn't even agree with that because they became pregnant. So clearly, they're able to because their body is saying yes. In one instance, they didn't make it that far along into the pregnancy, and the doctor was advocating that they terminate the pregnancy. I want to say that was like less than 10 weeks along. And then in another instance, the woman had made it to 20 weeks, and their care provider was advocating for terminating the pregnancy because they were really struggling with the symptoms, and the care provider didn't know why. They had ran different markers, everything looked normal, but the woman was miserable and she was having a really hard time. So the doctor had said, get the abortion and then we can pick up where we left off prior to having the abortion happen. And that's just not how it works. You don't walk in to this scenario where you've wanted, in this particular instance, this is somebody who wants to have a child, who has decided with their partner that they want to start a family, and they start struggling during the pregnancy. And so they reach out to the methods that we are told, this is the avenue that you need to go down. You need to talk to your doctor. This is part of the system. And then the system fails them miserably because then they have this abortion because that's what they're being told. Hey, this is a good idea. You'll get your health back to where you had it before. You can try another pregnancy later on down the road. And guess what? That didn't happen at all. She was worse off than she was when she was pregnant. And part of that has to do because she had terminated her pregnancy at 20 weeks and she wanted to be a mom, but she was having all of these issues that were popping up. And the place that she had turned to, because that's what we're conditioned, we're told, you're having issues, go to a doctor. Well, they're not trained in these things. They're not trained about mineral balance. They're taught to diagnose and prescribe. And that's part of the problem. So, um, I think that this is devastating and it's heart-wrenching, and it doesn't just end again, the when the abortion happens. We now have a woman who energetically is not the same, who is really struggling with her decision, who is looking for some kind of confirmation that she's made the right choice because she had given up on that side of things, thinking, well, now she thinks that her body's broken and she doesn't know why, when really we're not supporting women the way that they need, and we're not supporting families the way that they need, because this, again, energetically is massive, and it's devastating, and there's so many issues with it because, even if you're on the side of my body, my choice, well, what choice exactly is she making with that? Because she's trying to make a decision that she's being told, well, I don't know what's wrong, so the best solution is to just end it. But that doesn't make any sense because we're not solving anything by doing that. We are wanting the pregnancy, we're wanting the baby. And so to just end it doesn't make any sense to me at all because we're not even getting our health back. It's not a nothing thing. It's not like this didn't happen. It's horrific and it's heart-wrenching. And there's another side of this too where there's a male who has feelings, who has now lost their child because of what? Somebody didn't know something, so we're just going to take matters into our own hands. Like, it makes no sense to me at all, and I think that it's heart-wrenching. And and on top of that, another topic that I think is really important on, the abortion side of things is this narrative around low ferritin. So recently on Instagram and TikTok, I had posted dangerously low ferritin does not exist. And I will stand by that because I'm talking about the fear mongering that goes into one lab marker to say that we need, iron infusions because that seems to be the go-to. And I have multiple women now, especially after that post, who are coming to me and who are saying, hey, listen, I felt fine before I had my blood taken. They said I had low ferritin. One woman in this instance, she went out and had 10 iron infusions and then it now feels miserable and is trying to figure out why she even had them to begin with, just because this one marker was low. And it's, apparently all of this iron that's low in the body, which doesn't make any sense to me. And if you don't know about iron's movement, about iron regulation, I highly recommend. I have a video that's a preview to a series of videos that I have on the movement of iron fundamentals that you can find on my YouTube channel. And I highly recommend you starting with that because iron doesn't move with more iron. And if that was the case, then no one would be anemic because our foods in Canada, the UK, and the US have been fortified since 1941. And just to top it off, as if it's just me. Maybe it's Sam that's saying this doesn't work. But in order to increase the amount of food that was added in the USA, in 1969, a group went to the US government and said, hey, listen, we have been fortifying foods for the last 30 years and it hasn't worked. People are still anemic. Okay, so they had to admit that it didn't work in order to increase the amount of iron in the food. And then they proposed to add more iron to the food to solve that problem, that they hadn't added enough to begin with, which doesn't make any sense. Imagine if you were looking to invest in two companies and one company was, both of them are struggling, but one company was saying, listen, we've done this idea for 30 years and our best solution is to just do it even harder. And then another company is like, what we've done hasn't worked, so we're going to try this new idea. Like, which one are you going to pick? You're obviously not going to pick the one that's failed for 30 years and is just going to keep going with the bad idea. It doesn't make any sense. And that's part of the issue. If you've ever had bread, sometimes rice can be fortified. If you are consuming GMO foods, if you're consuming foods that have been sprayed with glyphosate, water having glyphosate on it, all of these different things contribute to how iron is being dysregulated in our body. It doesn't just mean that you have to have an iron infusion, iron supplements, although, looking at prenatals, multivitamins, all of these different things and how we are destroying that movement is that's huge. It's a really big thing. That's what I work with my clients, and that's how I help them improve their pregnancies, improve perimenopause, get pregnant, all of these different things. So back to ferritin. Iron is meant to be in hemoglobin. And I don't understand this narrative that ferritin is an accurate representation of all of the iron that we have in storage in our body. It makes no sense to me. There's 4 forms of ferritin. Did you know that? Did you know that when we're testing them, we're only testing for one? We're testing our serum ferritin. We're not testing the 3 other ones, which can be that go into mitochondria, and then there's heavy chain and light chain. So we're taking one marker and thinking, well, this is an accurate representation of everything that's in the body, but iron can be 10 times higher in your tissues than it is in your blood. And so that's part of the problem. We also need to look at how much iron is meant to be in ferritin. Maybe looking at it like, okay, less than 10% is meant to be in ferritin. So let's say 10%, just for argument's sake to make it easier. And 70% of your iron is meant to be in your hemoglobin. So when you think about it in that instance, if somebody said to me, "Hey, I have I have these two options for you. One with 70%, which, is a good indicator, and then another one with 10. Which one are you going to pick?" Obviously, you're going to pick the one which is 70%. And that's your iron's meant to be in your hemoglobin. And so part of the issue is if our iron isn't getting to the hemoglobin, then that's part of a movement of iron issue to get iron there so that it can be regulated and out of the tissues. And so I had a woman message me saying that her ferritin was low and that her family was advocating for an abortion because she was too low. So this, danger that goes along with one individual marker, not looking at things as a whole picture, but looking at things in isolation. And all of these people that, there's quite a few of them on social media that have such fear mongering that goes into this marker. Like, oh gosh, I don't even think I could repeat the stuff that they say because half of it is just nonsensical. The symptoms are the issue. I cannot stress that enough. So if we are struggling with fatigue, we're struggling with hair loss, we're struggling with all of these different things, we're struggling with weight loss. I've seen, ridiculous statements like your hair can't grow below 70 ferritin, you can't lose weight below 70 ferritin. Well, um, I have a 20 ferritin, and my hair is wonderful and long and luxurious, and that's not an issue that I have because I focus on iron regulation. I understand where iron's meant to be. And part of the problem is when we're taking iron, when we're having iron infusions, which I don't, again, I don't understand. Think of it like this. Iron is a heavy metal. So would it make any sense to you to go out and get an infusion of arsenic, of mercury? No, it wouldn't make any sense. But we've been bamboozled into thinking that because the body needs iron, that it's a safe heavy metal to have injected into us. And that's part of the problem because it's not just because one marker is low that means that that individual item is low in the body. It's really narrow-minded thinking when we're looking at things like that, and that's part of why I don't like discussing blood markers on, especially on comments. So if that's something that you're going to leave me, then I'm probably not going to answer it, or I'm going to give you an answer that you don't like because it's not linear like that. So for example, if I'm looking at a low ferritin, I'm thinking, is iron being moved effectively? Is it being recycled effectively? What are our B vitamins like? Because part of the issue, we need B6, we need magnesium. In order to get magnesium in the cell, we need B6. And there's more B vitamins than just B6 and B12. And a lot of people will be really dismissive of that and be like, well, I had my B12 checked and it came back within range. That's part of the problem. There's a plethora of B vitamins out there, and focusing on one as if, it's not linear. Again, there's multiple, they all have different purposes, and they're not ranked in their hierarchy. They are numbered based on when they've been discovered. So, it's important to look at that as a full picture approach. Another thing that's really important is parasites in the spleen. So, really common question, well, how do I know if my spleen has parasites? Look at traditional Chinese medicine. Look at some of the symptoms that they'll talk about being spleen deficient. So typically, if somebody's messaging me, I have a pretty good idea right away as to whether or not their spleen is something that could use improvement because they worry lots, they're really stressed, they're the kind of person that you can give them a suggestion to and then they really doubt it. They're the people that overconsume, like they're constantly on social media, they're constantly looking on these different things. Their boundaries are not really rigid. And if you're watching this and you're somebody who's like, well, I need a test in order to tell me that, then my videos are probably not for you. Because I think that we have to get away from this narrative where there has to be this test to prove things. Because I believe that our bodies are really smart, we're really intuitive, and that we can listen to the signals that our bodies are communicating to us to help them heal. And that this narrative around testing can be beneficial to help give us a little bit more insight to where the stress is in the body, but the test should never be like the bee's knees. It shouldn't be this part where we're like, well, I have this number on this test and this is what I identify with now. That's part of this narrative in order to keep us sick, because a lot of people will say, I have Raynaud's. Do you? Your body isn't capable of healing? Do you have like the symptoms of Raynaud's? Are you going to now identify with that label that they've given you? Or, is it capable that your body can heal, that you can support your body? Maybe that's something that you struggled with at one point in time, but why does that become your identity? I think that's a little bit of a discussion for another day. But back to this ferritin hoopla. So, you know, there's all of this fear that goes into this one isolated marker that isn't even telling us. If you wanted to know exactly how much iron is in your tissues, you would need a needle biopsy or expensive testing equipment, none of which I want. And to be honest, I don't think I would know. I don't want to know how much iron would be in my tissues. I don't think that would do me any benefit to have some kind of test to tell me that. I think that would bring on more fear than anything to see how much is actually there. Um, and so I think that there's this shift that really needs to happen in terms of women's health and wellness, where we and I know that I can be accused of doing this. Anybody can. Anybody can come to my page and be like, well, low iron, it's a serious issue, you're doing a lot of harm, blah blah blah. No, I'm not talking about the dangers that come from when to me, the issue is that we have exposure to too much iron. And so I don't see there being any benefit in saying this is what can happen when you have too much, because I think anybody with half a brain can figure that out on their own. And second of all, there's already too much fear that's going on. Fear is an easy way to get people to comply. And we learned that 6 years ago. So I don't think that talking about the things that we need to fear from iron dysregulation is beneficial. I do think that it's really important that we talk about the different issues that women are being exposed to when they are going to what we are being told is our traditional path that we need to explore. This is who's able to help you. They're going to where they're supposed to get help. And then the answer is abort. And I think that is a big, big issue that we need to be aware of, that we need to be conscious of, because when we're not, and we're at a time in our lives when we are really unsure of what to do, then it's a really vulnerable situation. And I think that that's a big, big issue. So if you're watching this and you're struggling with your pregnancy, just because somebody doesn't know doesn't mean that there isn't a reason for it. And I think that's really important. A lot of the time people will talk about, we don't know why some women hemorrhage, we don't know why some women get gestational diabetes. In my mind, there's some pretty good reasons why those things happen. But a lot of the time, people aren't trained in that. They're not aware of what those reasons are. So just because that one person doesn't know doesn't mean that there's not a reason for it. And when we're thinking of how to help heal the body, how to come together as women and support each other, I think this really needs to be foundational. And, I'm not anti-doctors. I'm not against, doctors in general. I think that doctors are really helpful. I think that they hold a lot of value. And I think that that is, sorry, someone came to the door. I think that's really important, that I want to point out that I'm not anti-doctor, and you won't see me talk badly about them as a whole. I'm talking about the system that's in place, because these women are from different countries. So, it's not just like a one country issue. This is happening in multiple places. And I think that a lot of doctors do mean really well, And I think that they are in it because they want to help people. I think it's the system overall that is failing women. And I think that that's a pretty big issue. So if you're struggling with your pregnancy, um, find somebody who resonates with you and ask for help. That person might not be me, and that's okay. This isn't a video about, don't work with doctors, work with me. That's not what this is about. This is about bringing to light some of the issues that are happening within women's health and wellness, and how we have the power to make the changes. We have the power to, um, it's really amazing the amount of change that we can bring, and I think that's that's the purpose of this, is to voice that so that we can then bring changes and um, make things come to light so that they are for the benefit and the greater good of us, because that's really important. Um, because we don't have to struggle. That's not part of it. Pregnancy doesn't have to be a burden, and we also don't have to terminate a pregnancy in order to figure that out. So, if you're looking for help, I highly suggest finding somebody who aligns with you, find somebody who, resonates with you, who explains things in a way that you really like. And um, I really hope that if you're someone that's struggling, that this gives you the permission to that you're able to enjoy your pregnancy, and that that's not the only option.